Hello, Harry, members of the Executive Committee, all my friends and colleagues who are attending the conference arranged by the Partners on Population and Development in Yogyakarta in Indonesia. I'm speaking to you from New York, and I'm really sorry that I can't be with you in person. In New York, the United Nations recently ended a high-level session on the Millennium Development Goals. Many of us were speaking up during the meeting, identifying and lobbying hard for an additional goal in the fight to end extreme poverty. We believe that a new and explicit goal is needed to reflect the importance of sexual and reproductive health and rights, including family planning. My colleagues in official delegations and the NGO community believe that the 8 goals as they stand are insufficient. They don't reflect the importance of what we did at the International Conference on Population and Development and what has been in the years since then. At ICPD, the consensus of 170 nations agreed that universal access for reproductive health information and services should be achieved by 2015. Reproductive health includes not only safe motherhood and family planning, but protection and treatment from sexually transmitted diseases, including HIV and AIDS, prevention of gender-based violence, and everything else to do with the reproductive health system. You have all done great work towards implementing the Cairo consensus. Your work is beginning to show results. Access to the whole range of sexual and reproductive health services has improved the health of millions of women around the world. The estimates of maternal mortality have fallen by nearly 40% compared with 2005. This year alone, nearly 200,000 more women will survive pregnancy and childbirth. Your efforts are saving lives. At the rate of 1 every 2 minutes, the life of a woman who might have died as a consequence of pregnancy. We can say with certainty that your work and the work of all the countries and organizations like PPD to implement Cairo is finally bearing fruit. All the more reason then to redouble our efforts. We have a long way to go. We are not yet in sight of the goal of universal coverage by 2015. The resources going towards implementing Cairo and especially to family planning have not risen the way we hoped. The strange fact is that resources going towards family planning have fallen to 5% of the total from about 45% of the and that was there at the time of ICPD. Yet there are still 200 million women who want to use safe and effective methods but are unable to do so. Voluntary access to safe, affordable and appropriate means of family planning is a matter of human rights, but it is also a matter of national policy. In about a year's time, the world population will rise above 7 billion. In the first 12 years of the 21st century, the world will have added 1 billion people. Most of that growth will be in the poorest countries where fertility is still very high and access to family planning and to sexual and reproductive health services of all kinds is still very low. In this case, the demand of human rights and the necessities of national policy coincide. No country that pursues the goal of ending extreme poverty can afford rapid population growth. High fertility adds an enormous burden to the costs of development. On the other hand, lower fertility and smaller families provide a one-time development bonus. The productive workforce increases and the costs of education and health programs go down. Reducing fertility is relatively simple. Women in high fertility countries want safe pregnancy and childbirth. They also want smaller families than their mothers did. Provide women with the services they want, including family planning, and fertility will decline. This is not a new idea. In fact, it lies at the heart of the ICPD consensus. Every subsequent major international and regional conference on social issues has endorsed it. Women in high fertility countries want smaller families. Their governments want affordable development. Their goals are in agreement. What is missing is the will to act and the resources to turn will into action. We know what to do and how to do it. Sexual and reproductive health services must be integrated with HIV/AIDS prevention. Services must reach all people who need them. This includes unmarried women and young married women before their first child. Young people of both sexes need age-appropriate information and services. Men of all ages need to understand and take up their responsibility for sexual and reproductive health. It includes all groups, including marginalized groups like sex workers and intravenous drug users. It also includes men who have sex with men and people living with AIDS. Leaders need to give an example of responsible behavior, and policymakers at all levels need to give priority to this most pressing concern. This is why we pushed so hard last month at the United Nations for a new Millennium Development Goal. We didn't succeed this time, but we made our voices heard. I hope you will make your voices heard also at the highest levels internationally, in your own countries and in your families and communities. Make it a priority of PPD to help achieve universal access to sexual and reproductive health services by the year 2015. The world needs us to realize the promise of Cairo. I am sure you will do your part, and I wish your conference all success.